Okay guys, we got a weird kind of lighting situation here, but no matter which way I turn it, those lights are gonna be shutting down. Weird. So, this is kind of the dance. I got a video today, guys, that I posted before, or I preluded to, and I want to talk about surgery and post-operative care and just, you know, some tips that might help some people. It might seem like mundane and like self-explanatory to other people, but the whole reason why I'm posting this video is because I'm noticing, just as a trainer, training people through injuries and training people who have had surgery, that some tips that if they had known beforehand, it really could have helped their healing process and their rehabilitation process. So this is what this is about. Hopefully I've put a title that's self-explanatory enough, and I'm already a minute into the video, so I'm gonna get right into it. My first tip is, whenever you have a pain that lasts more than a week, let's say. I mean, you should never be doing a workout that you're sore for a week afterwards. You're going a little bit too hard if that's the case, and we've all done it. I think the most sore I've been after a workout is 5 days, and you can tell when it's, if you're used to training, you can tell whether it's that lactic acid pain, that muscle pain, or whether it's a sharp pain and you've actually injured a joint or you know, torn a ligament or a tendon or soft tissue or something. So anyways, when you feel pain, sharp pain, my first tip is don't ignore it. There's something wrong. So you want to try to, before you go to the doctor, before you run off to your physiotherapist or your chiropractor, which are all good, and I definitely recommend, if you're working out on a consistent basis, you need to have some kind of physiotherapy or chiropractic care just as maintenance along the way, and even massage therapy. Just helps make the muscles more pliable and get knots out and stuff. Gives you more range of motion, more functional movement. Anyways, getting off track again. Try to target that pain, which is very difficult sometimes, especially if there's a nerve involved. But anyways, try to target the pain where it's stemming from, and do a little bit of research yourself first. Whether that means, you know, talking to your physiotherapist or whoever before you go to your doctor. Try to get on the internet and see what it could be first. A lot of times these days, and probably always, but I mean these days meaning, you know, we've got technology at our hands, we've got so much information at our hands, that you can look something up. And sometimes the internet can be a bad thing, sometimes it's too much information and you end up, you know, seeing too much, and it's, you know, you end up thinking that you've got some fucking some rare disease when all you really have is a twisted elbow. So do the research first. Try to isolate, try to figure out what it is, what kind of injury it is that you might have, then go to your doctor. Once you go to your doctor, this is stemming from my own experience, ask for an ultrasound or ask for an x-ray, ask for an MRI. Depending on your doctor, they may be really good. They may send you for one right away, or you may have the kind of doctor that doesn't think you need one, and you end up going back to playing soccer, going back to running around like a fool up and down hills and up in terrain and whatever, and then you end up finding out that you've actually torn your Achilles partially, and if you had that MRI about a month ago, you wouldn't have ended up in a cast. But anyway, okay, so once you have that MRI, once you have those results, if there is an injury, if you have some kind of, you know, tear or whatever, you want to find a good trainer, you want to find a good physiotherapist, you want to find, depending on what the injury is, chiropractor, massage therapist, all of these things. You want to find good ones. Going off a little bit, you don't want to, and some of these examples have to do with things that I've encountered with clients. You don't want to end up with seeing a doctor who just keeps injecting your joint with cortisone shots. All that's going to do is band-aid the problem. And if you don't end up getting surgery on that area, or you don't end up getting proper care, you don't end up strengthening that area, it's just going to get worse and worse, and it's going to be bad. So if surgery is necessary, you want to find a good surgeon. Whether this means being put on a waiting list or whatever, going to, traveling and having your surgery somewhere else, do it. You want to have a good surgeon. You want the job done right, especially if we're dealing with a knee joint or a rotator cuff or a hip or something like that, something that your quality of life depends on. You need a good surgeon. I mean, that should be a given with anything. It's your body. You want the best. It's your only body. You want the best to deal with whatever problem you may have, and that goes with everything. But this video is about surgery. So you want to find out, a lot of times they're going to, you're going to go through pre-op stuff once you do get in with the surgeon or whatever. They're going to go through pre-op stuff, and they're going to give you handouts and whatever, and they're going to explain what's going to happen post-op. So you want to take this time to discuss with your doctor what kind of pain meds you're going to be on, what kind of medication that you're going to be on once you're finished the surgery. The reason why this is so important is because if you're not on the right anti-inflammatories, if you're not on the right type of pain meds, it could really impede your recovery. If you're in pain and you don't have pain meds, what's going to happen is everything's going to seize up. And I'm talking even if you've got a knee injury or an ankle injury, if you've got intense pain somewhere in your body, you're going to end up like this. Everything's going to end up rigid. Nothing's going to be pliable. Nothing's going to want to move the way that it's supposed to. Make sure you've got good pain meds. Don't be a hero. Don't try to do it without any pain meds. And not just that, but make sure that they don't forget to prescribe them to you. I've got two instances that I can think of right now. One that involved my son. My son went in for, this is when he was little, he went in for elbow surgery. He broke his arm just playing, and where he broke it was at a growth spot in his elbow. So they had to do surgery immediately. So we ended up waiting for an orthopedic surgeon. The surgery was done. My son was only probably about 4 years old. And so my son comes back to me post-op at the hospital, and they gave him some pain medication right after surgery, or during surgery, I'm not sure. But the surgeon left right after because the surgeon had actually come from out of town, and I didn't get to speak with the surgeon, and my son didn't have any pain meds. So I ended up spending 24 hours in the hospital with my son with no pain meds, and the nurses kept telling me that all they could give him was Tylenol because of his age, because he was 4 years old. So my poor little boy was in a cast and with 2 pins in his elbow and didn't have the proper medication. Sorry, I just got a carrier update. Just because I missed the opportunity, I missed that window to ask the surgeon for the proper pain meds, and he forgot and he left. So it sounds like ridiculous, and it sounds like these things, it sounds like it was probably fault on my part, but at the time I was dealing with the shock and awe of my son having to go in for surgery and breaking his elbow, and I feel like it should have been taken care of. It wasn't something that I, as the mother, should have had to have thought about at that time. And I didn't think about it until, an hour after the surgeon had already left. So anyways, things like this do happen all the time. Prescriptions don't get faxed to pharmacies. And sometimes people who have had surgery think they call the pharmacy and they're asking for their prescription. And when they're told from the pharmacy that no, it wasn't prescribed, nobody prescribed you any pain meds, some people are just going to think, and this is speaking from somebody that I'm dealing with, some people are going to think, and I would think the same thing, that, okay, I'm supposed to, grow a set of balls, so to speak, and I'm supposed to tough out the pain. And especially if your surgeon is from out of town, and I mean, what do you do? So the ball gets dropped a lot of times is what I'm trying to say. Trust your gut, be demanding. If you need pain meds, call your surgeon, do what you have to do, get your pain meds, get your anti-inflammatories. It's going to speed up the process a hell of a lot more because, like I said, you're going to be able to work that joint. You're going to be able to do your physiotherapy exercises, your rehab exercises, and it's once you get a new joint, I'm talking about joints now, but once you get a new joint, it's really just a matter of mechanics. So you've gone from having something that is broken and doesn't work that well, and a lot of times with joints, it ends up being bone on bone. So once you get that brand new joint, whether it's a partial or a full joint replacement, you've got like the Cadillac of joints now. So it's just a matter of mechanics, getting the tendons and ligaments and muscles to move with that joint now. Okay, so let's say that everything's gone smoothly. Let's say that you've had a great surgery, everything's going great. You're in pain, but you've got pain management, you've got your medication, and so everything's good. The one thing that your doctor, they may not tell you about, is the emotional strain that you're gonna go through. Nobody really warns anybody about this, and I think it's because your doctor doesn't want to set you up for failure. So your doctor's not gonna say to you, they're gonna talk to you about the positive things that are gonna happen. I mean, yeah, they're gonna talk to you about the pain or whatever, pain management, but they want you to get through it and they want you to succeed. Nobody's gonna sit you down and say, you might go through a depression, you might go through anxiety, you're gonna feel helpless, you're gonna feel victimized. Nobody tells you about this, and it's something that you can very easily fall into. And the reason being is, it's funny because I just had this conversation with one of my friends a little while ago. In this day and age, I'm aging myself by saying that, but in this day and age, people work so much, and everything, the type of lifestyle that most people have is just so fast-paced, and everything needs to be done like right now. Everything's expected to be done right now. And so you deal with that. You go to work and that's what you deal with all day long. Then you come home and your kids want everything right now, or your husband wants everything right now. Like, it's just, even TV, your phones, everything, updates on your phones, it's supposed to happen right now. So when you're working like that and you're dealing with this stress every day, there's times when I'm sure it occurs to other people that, you know what, if only I could just, not thinking about a vacation, but like, if only I could just have a timeout. If only I could just like lay back for a week or even more than a week, and just kind of lay there and have people look after me. And I'm sure that there's a lot of people that think that. It sounds morbid, but it's almost like you wish for some kind of like minor injury just so that you can have a timeout from it all. But when it happens, the time passes, especially if it's a major surgery. This time passes, and especially if you're a caregiver type personality, you can find yourself, and it's very gradual, you can find yourself, your process of thinking snowballing into a feeling of helplessness and a feeling of guilt. And it's because you're used to doing so much, especially if you're dealing with something where you're on crutches or you're laid up in bed, and everything that you used to do for your family, they're now having to do for you. You can't drive. You can't even go down and make yourself breakfast. Things that came naturally to you, things that you took for granted, you can't do now. You can't go to let's be honest, you get out of surgery, the first week or so, you can't go to the bathroom by yourself sometimes. So this feeling of guilt and feeling of helplessness can sometimes snowball into a feeling of, this anxiety and depression go hand in hand. And no doctor, no surgeon is going to warn you about this. So it's two-part. You end up thinking that now that you're having these feelings, you end up thinking, what's wrong with me? Why am I feeling like this? I've had the surgery. I've got a brand new joint. I'm gonna get better. Your family's wondering what's wrong with you because you're starting to feel depressed because your whole quality of life has changed. And it ends up being a really hard thing for the family and for the patient to deal with. So I just want to say that if you are going through that and you're feeling helpless and you're feeling like a victim and you're not used to feeling that way, it's normal. It's gonna get better. You have to change your thinking around. you may feel helpless and you may be helpless, but you're not a victim. And by strengthening, by doing, if you're keeping up with your exercises and you're going to physio, it's like I said earlier in this clip or in this video, that it's a matter of mechanics. You've got a brand new joint, or you've had something that's been operated on and it's been made better. So yeah, you might be in pain right now. You might be immobile. You might not be able to drive yet, but you've got to work on strengthening that. And if you focus too much on the pain and not working to strengthen that area and not pushing at least a little bit through the pain, through the uncomfortableness, it's not going to get any better. You need a proper trainer, you need a proper physiotherapist, chiropractor, whatever it is. You need the proper care. So yeah, always do your research first. Make sure you've got a good surgeon. Make sure you got a good team. It takes a village, really. Like, you need a good GP, you need a good surgeon, you need a good rehabilitation team, and then in the long run, you need a good trainer. Somebody who's going to strengthen that joint and teach you how to do exercises properly with proper form, so that you avoid injury next time, and teaches you how to lift. There's just so many things. I won't get into it. So anyways, this is my second video that I think I've done with where I've tried to be at least a little bit serious. So I know these videos aren't very good quality. I'm literally doing it on my phone in my basement and the lighting's not great. But hopefully the information has helped somebody. Again, if you're one of my clients or whatever, you have any questions, or you're just somebody out there who has questions, I don't expect this video to go very far. But my email address is bodytuner360@gmail.com, or you can leave me a question or whatever down below. Okay, thanks, bye.